Psoriasis is a common chronic skin condition that causes additional cells to grow up on your skin by speeding up the life cycle of skin cells. Scaly patches form as a result of the buildup, which can be uncomfortable and itchy. These spots, which are usually red with silver scales, come and go, flaring up for weeks or months before fading away. Psoriasis is most commonly found on the elbows, knees, lower back, and scalp, although it can also be present on the face. However, having psoriasis exclusively on one's face is uncommon. The majority of persons who have psoriasis on their faces also have psoriasis on their scalps. Others have psoriasis on various portions of their bodies, ranging from mild to severe. Symptoms of facial psoriasis. Facial psoriasis comes in a variety of forms. They're all characterized by itchy, uncomfortable, and irritated skin. Psoriasis around the eyes can cause red, crusty eyelids, as well as eyelashes that brush against the eye. Psoriasis can also impact your hearing by appearing inside and around the ear. Scratching psoriasis lesions can result in broken skin and infection in some circumstances. Psoriasis can have a negative impact on your self-esteem and overall quality of life. The most prevalent type of psoriasis is plaque psoriasis, which manifests as elevated, scaly areas. The pink spots in guttate psoriasis, on the other hand, are smaller and less thick. Ethrodermic psoriasis is an uncommon form of psoriasis. It's usually accompanied by a widespread red rash, temperature changes, and an increased sensitivity. Other kinds of psoriasis, such as scalp psoriasis, can develop alongside facial psoriasis in roughly half of patients with psoriasis. When compared to psoriasis on other parts of the body, there is some evidence that face psoriasis is a marker of more severe psoriasis. Psoriasis on the face comes in a variety of forms. The following are the three main forms of psoriasis that develop on the face. Psoriasis with a hairline. Hairline psoriasis is scalp psoriasis, plaque psoriasis, that extends past your hairline and into your forehead and ears. Scales from psoriasis can accumulate in your ears and obstruct your ear canal. Sebapsoriasis. Both psoriasis and seborrheic dermatitis are signs of sebapsoriasis. Seborrheic dermatitis, a chronic form of eczema, is a common skin disorder that generally affects the scalp and causes dandruff. It could also affect other sections of the body. Patchy sebapsoriasis at the hairline is common. It can be found on the following items: a pair of brows, the lashes of your eyes, section of your beard, the point where your nose and cheeks meet. Despite the fact that sebapsoriasis is sometimes confused with widespread scalp psoriasis, the patches are usually thinner, lighter in color, and have less scales. Psoriasis of the face. Facial psoriasis can affect any region of your face and is often related with psoriasis elsewhere on your body, such as your scalp, ears, elbow, knees, torso. Plaque psoriasis and guttate psoriasis are two types of psoriasis. Psoriasis of the face has several causes. Face psoriasis, like psoriasis on other parts of your body, has no known etiology. Heredity and your immune system both play a role, according to researchers. Psoriasis and psoriasis flare-ups can be brought on by the following factors: stress, sunburn and exposure to the sun, a yeast infection. Lithium, hydroxychloroquine, Plaquenil, and prednisone are examples of drugs. Rayos. The weather is cold and dry. Use of tobacco. Excessive use of alcoholic beverages. Psoriasis of the face has a number of risk factors. Psoriasis is caused by a combination of conditions that can enhance your chances of developing it. One example is family history. You're more likely to have psoriasis if one of your parents has it. Psoriasis is more likely to affect persons who have HIV or other autoimmune conditions like lupus, or who are receiving chemotherapy, thus a weakened immune system is a problem. Scratches and sunburns on the skin may also have a role. Obesity, as well as some drugs including lithium, antimalarials, and beta blockers, can have this effect. Psoriasis can be exacerbated by smoking and alcohol consumption. Psoriasis diagnosis. A doctor or dermatologist will ask you questions about your symptoms, such as itching skin, to diagnose face psoriasis. They may also inquire about your family's history of psoriasis and whether any of your close relatives have had the disease. They may also take a small biopsy of your skin to examine under a microscope and confirm your diagnosis. You might also be asked about changes in your life, such as whether you're more stressed or using new drugs. It's worthwhile to double-check your diagnosis. Psoriasis can be confused with a variety of skin disorders, including seborrheic dermatitis, ringworm, and medication reactions. Treatment for psoriasis on the face. Face psoriasis must be treated with caution since the skin on your face is extremely sensitive. Corticosteroids. A range of treatments, including mild corticosteroids in the form of an ointment, lotion, or cream, may be recommended by your doctor. When symptoms are at their worst, these can be used on a daily basis. When applying any medication to your face, keep your eyes out of it. When applied near the eyes, a special steroid medicine is utilized, but too much might cause glaucoma and cataracts. Analogues of vitamin D. Some of the other topical therapies are simply vitamin D derivatives. Betamethasone, calcipotriene is one of them, Enstellar, Taclonex. Calcitriol is a hormone that is produced by the body to vectical. Calcipotriene is a kind of calcipotriene that is Dovanex, Sorelux. Inhibitors of calcineurin. Calcineurin inhibitors suppress the enzyme calcineurin, which is involved in several immune system activities. They're safe to use around the eyes. They won't induce glaucoma, although they could sting for the first few days. Tacrolimus, Protopic, and pimecrolimus are two examples, Elidel. Retinoids. Tazarotene, Tazorac, and other retinoids operate by lowering inflammation and inhibiting the overproduction of skin cells. A dermatologist may give oral or injectable medication, like azacitidine, a retinoid in pill form, if retinoid creams and gels aren't effective, Soriatane. These, like topical retinoids, act by delaying the formation of skin cells. Phototherapy. Phototherapy, or light therapy, is another option. UV radiation is used in a controlled environment in this procedure. Although natural sunlight can be beneficial, it is not the same as prescription phototherapy. Don't overdo it with the sun. Keep in mind that some topical treatments may increase your risk of sunburn. Home cures for psoriasis on the face. You can assist control your psoriasis at home, in addition to taking the medicine prescribed by your doctor. Reduce your stress levels. Consider meditating or practicing yoga. Stay away from potential triggers. Keep a close eye on your diet and activity. Picking at your patches is not a good idea. Attempting to remove scales usually makes them worse or causes new rashes. Make use of a moisturizer. Request that your doctor prescribe a moisturizer that will aid in the reduction of dry skin and scaling on your face. Obtain emotional assistance. Patches on the face might make you feel self-conscious and even unhappy at times. Your doctor may be able to refer you to a support group or psychologist who may assist you. Try these skincare products for psoriasis on the face. Finding a skincare routine that works for your face psoriasis is crucial, though you may need to try a few different products to find one that works for you. You may discover that using an over-the-counter emollient, in addition to considering prescription creams with your doctor, is beneficial. These moisturize the skin and can form an oil barrier to keep it from drying out. Glycerin and aloe vera, for example, are humectants that can help moisturize your skin. Look for treatments that contain salicylic acid, which can help your skin shed psoriasis scales, or coal tar, which helps relieve irritation and inflammation. Consult a physician if you have psoriasis on your face. Consult a physician to determine the type of psoriasis that has developed on your face. They can suggest a treatment plan for your psoriasis, which may include medical and at-home care. Because psoriasis on the face can be emotionally uncomfortable for some people, your doctor may have advice on how to deal with any self-consciousness about your psoriasis on the face. They might suggest a support group or makeup that won't interfere with your treatment, for example.